This mini lesson will be on likelihood ratios. Likelihood ratios are used to estimate the value of a diagnostic test. They're a comparison between two different likelihoods. The likelihood that an individual with a certain condition would have a specific test result compared to the likelihood that an individual without that same condition would have the same test result. Typically, there are positive and negative likelihood ratios, and this is for tests that have a binary result, something that's positive or negative. But you could also compute likelihood ratios for a range of results or multi-level likelihood ratios. So for example, if you had a test that gave you no diagnosis, mild, moderate, and severe, you could calculate likelihood ratio for each of those levels. Positive likelihood ratio is the probability of an individual with a condition getting a positive result over the probability of an individual without the condition getting a positive result. So you can think of it as true positives over false positives. And if you're looking at the interpretation of positive likelihood ratio, if it's greater than 1, that means the test result is more likely to be positive in an individual with the condition, which is a good thing. If it's equal to 1, it's equally likely to be positive in either of those patient groups. And so that's not helpful. And then if it's less than 1, the test result is more likely to be positive in an individual without a condition, and that is definitely not good. So looking a little further into guidelines for interpretation of positive likelihood ratios, we expect it to be greater than 1, but how large is large enough? And these are just a kind of general guidelines that you can use. So if it's greater than 10, there's really strong evidence that you can rule in or give a diagnosis with that diagnostic measure. If it's between 5 and 10, there's moderate evidence to rule in or give a diagnosis. If it's between 2 and 5, there's weak evidence. And then if it's between 0.5 and 2, so right around that 1 mark, essentially there's not evidence that you can use the tool to give a rule in, or to give a diagnosis or rule in a diagnosis. So negative likelihood ratios, as you might expect, are kind of a flip of positive likelihood ratios. It's the probability of an individual with a condition getting a negative result over the probability of an individual without a condition getting a negative result. And so it's false negatives over true negatives. And then the interpretation of negative likelihood ratios is also flipped. So if it's greater than 1, the test result is more likely to be negative in an individual with the condition, and that's not a good thing. If it's equal to 1, the test result is equally likely to be negative in both groups, whether they have the condition or not, which isn't helpful. And then if it's less than 1, the test result is more likely to be negative in an individual without the condition, and that's a good thing. So we expect negative likelihoods to be less than 1, but how small is small enough? If it's less than 0.1 or 1/10, it's strong evidence that you can rule out a diagnosis. If it's between 0.1 and 0.2, there's moderate evidence to rule out a diagnosis. If it's between 0.2 and 0.5, it's weak evidence to rule out a diagnosis. And then again, similar to what we saw with the positive likelihood ratios, if it's between 0.5 and 2, there's essentially no evidence that you can rule out a diagnosis. All right, so tying likelihood ratios to one of the other mini lessons for today, sensitivity and specificity. Likelihood ratios actually incorporate sensitivity and specificity within the calculation. So a positive likelihood ratio is sensitivity divided by 1 minus the specificity, or true positives over false positives, as we talked about earlier. And a negative likelihood ratio is 1 minus the sensitivity divided by specificity, or false negatives over true negatives. This is important because if you are given sensitivity and specificity in an article, you can derive the likelihood ratio. And you might use this if you're trying to compare results across different diagnostic studies where some use likelihood ratios and some use sensitivity or specificity. In general, likelihood ratios are considered a better measure of diagnostic accuracy than sensitivity and specificity. However, likelihood ratios are more complex to calculate because you have to convert back and forth between probabilities and odds, which is, I think, a little more difficult thing to understand. All right, so here's an additional resource, a YouTube video, and I included the YouTube link and the made a bit.ly link just because I know the YouTube link was a little problematic last time. But if your group is going to be reading articles that refer to likelihood ratios, or if you just want to have a better understanding of likelihood ratios, this video is a great quick tutorial that will give you an understanding of the calculations of likelihood ratios. And the calculations are actually a little more complex than the formula we saw in earlier slides may lead you to believe, because it involves a combination of looking at pre-test probability and converting it to odds, and then post-test odds and converting it back to probability. So it's a little more complex than you might think. So thanks for listening, and hopefully you have a better understanding of likelihood ratios after this mini lesson.